Why is radical hysterectomy a cervical cancer option? Imagine facing a diagnosis of cervical cancer and wondering what the best treatment might be. One common surgical option is the radical hysterectomy, but why is this procedure often chosen? To understand that, we need to look at how cervical cancer can spread and how surgery can help. Cervical cancer starts in the cells of the cervix, but in some cases, it can grow beyond the cervix into nearby tissues. These tissues include the perimetrium, which is the tissue surrounding the cervix, and the upper part of the vagina. Early-stage cervical cancer, especially in stages like IA2 or IB2, is usually confined to the cervix, but microscopic spread into surrounding tissues is possible. A radical hysterectomy is designed to remove not just the uterus and cervix, but also these adjacent tissues that might harbor hidden cancer cells. The goal is to eliminate all visible and microscopic disease, reducing the chance that the cancer will come back. Along with removing the uterus and cervix, the procedure often includes the upper part of the vagina, the perimetrium, and sometimes the fallopian tubes and ovaries, depending on the patient's and health. In addition, surgeons usually remove nearby pelvic lymph nodes to check for cancer spread. These nodes are common sites where the cancer might spread early, so removing and examining them helps guide further treatment. This comprehensive approach aims to catch and remove any cancer cells that could lead to recurrence. While radical hysterectomy is effective, it is a major surgery with potential risks. These include injury to the bladder or ureters, which are the tubes that carry urine from the kidneys to the bladder. Some women may experience urinary problems or incontinence afterward. Recovery can take several weeks and may impact quality of life and sexual health. Because of these factors, doctors carefully evaluate whether a radical hysterectomy is necessary or if less extensive options could be suitable. Recent studies, like the SHAPE trial, have shown that for very low-risk early-stage cervical cancers, such as tumors smaller than 2 centimeters with limited invasion, a simple hysterectomy might be just as effective. This less radical surgery involves removing only the uterus and cervix, which can lead to fewer complications and a quicker recovery. However, selecting the right patients for this approach depends on strict criteria, including tumor size and depth of invasion, and should always be decided by a specialized healthcare team. In summary, radical hysterectomy is a key option for treating cervical cancer because it offers a thorough way to remove cancer that might have spread beyond the cervix. It is especially useful when the risk of local spread is higher based on the tumor's stage and characteristics. But for some women with very early, low-risk disease, less invasive surgeries might be enough. Always, the choice of treatment should be personalized, made in consultation with healthcare professionals who can weigh the benefits and risks based on individual circumstances. It's important to remember that ongoing research continues to refine these options, aiming to find the best balance between effective cancer control and quality of life. If you or someone you know is facing treatment decisions, discussing all available options with a gynecologic oncologist is essential to ensure the best possible care.